Coming up today, a milestone for the first ever Proton Therapy Center in Kansas City. We celebrate 500 patients and counting who chose this innovative cancer care. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Back in 2021, our region's first ever proton radiation machine traveled from Brussels, Belgium to Kansas City, Kansas. Less than a year later, doctors at the University of Kansas Cancer Center started using it to treat local cancer patients who would otherwise need to relocate to Texas or Arizona or even farther to get the same care. Now it's 2025 and more than 500 patients have received the what's called precise beam of hope to treat their cancers. And today we are talking with just some of the experts behind our Proton Center. Dr. Ronald Chen right here is the chair of radiation oncology at the University of Kansas Cancer Center. He has written books and national guidelines teaching doctors around the world how to treat cancer. Good to have you with us.
Good morning.
Across from me is Dr. Ronnie Rotondo. He is the Cancer Center's medical director of proton therapy. He is also the first doctor in the world to have completed 2 years of dedicated pediatric proton therapy fellowship training. How are you?
Good morning.
Good to have you here on this Monday with us. Next to him is Sarah Gregory. She is our proton nurse navigator who patients rely on for guidance when planning and managing their care when it comes to proton therapy. So good to have you with us.
Thanks.
You're kind of that front line, and the patients really love you. So it's good to have you with us, and just congratulations on this big milestone.
Thank you.
Because I remember when you all introduced me to the very first patient several years back. I interviewed her, and it was just such a big deal. And here we are, 500 patients and counting in. So before we dive into that, Janine Kiesling introduces us to a man from Wichita who had a sore throat that just would not go away. And eventually, he became our 500th proton therapy patient.
Give me your best smile, Robert.
How's your day been so far?
Robert Piper never thought he'd be part of a medical milestone, but after his throat cancer diagnosis, his doctor referred him to the University of Kansas Cancer Center for proton therapy.
They're on the cutting edge up here. Nothing against Wichita or anything, but they don't offer this type of technology.
Ready?
Proton therapy is a precise beam of radiation that targets tumors while sparing healthy nearby tissue. It's ideal for patients like Robert battling throat cancer. Proton therapy gives him a greater quality of life after treatment. The University of Kansas Cancer Center was the first in Kansas and in the Kansas City region to offer proton therapy.
Here we go.
Robert and his wife Debbie traveled from Wichita and opted to stay at Hope Lodge, a home providing free lodging for cancer patients who need frequent treatments like Robert.
This just took a lot of the stress and anxiety away, and it has been a great place to stay.
Robert says he chose proton therapy because of its targeted approach and fewer side effects. But what stood out the most? The people.
Everyone I've met since the start of this up until now has just been great. They've all been very professional. They're easy to talk to. They'll answer any questions.
For Robert and Debbie, the ability to get his treatment so close to home made a difficult journey easier.
I can make it in good weather in 2.5 hours, so that's not bad. I think we're all very fortunate because I think they're on the forefront of a lot of different things, and I think that's very fortunate for us.
Robert says he met a man from Denver who's traveling to the Cancer Center for his proton therapy, which reinforced to Robert that Kansans are lucky to have proton therapy so close to home.
I believe that my symptoms would probably be worse if I did the chemo and radiation in Wichita.
I'm good to go.
You're good to go?
Good to go.
Dr. Rotondo, I want to start with you because we're hearing the word travel a lot from Robert, our patient there. How important is a place like Hope Lodge for patients like Robert traveling when it comes to a therapy like proton?
So we're incredibly fortunate to have Hope Lodge here close to our facility. The American Cancer Society's Hope Lodge program offers a free home away from home for patients who are undergoing cancer treatments and their caregivers. And it offers a community of support of other cancer patients undergoing treatment in a nurturing environment. And for many patients, they can travel, from 2.5 hours to 4 hours or more. And many of our treatments can be 5-6 weeks or up to even 8 weeks for certain diagnoses. And so that makes it really prohibitive. There are also many patients and families who can't afford to pay for a hotel for that period of time. So the Hope Lodge is kind of a peace of mind for patients to be able to access care, and that's the critical thing, is trying to facilitate and access care for patients who need this treatment, regardless of how far they are or their ability to find lodging for themselves. So it's an incredible asset, and we're very fortunate to
Hope
have
Lodge,
it.
a really, really special place. Sarah, we mentioned you're a nurse navigator for Proton Therapy. Can you just explain your job and what do you do for patients?
Yes, nurse navigators wear a lot of hats, but one of the most important one is we are that first contact with patients on this journey. So, a lot of time we spend assessing, like we were talking with Hope Lodge, barriers to care, whether that's transportation or lodging, and making sure we get the right support through our social workers and access. We're trying to make sure we get timely, and well-coordinated care for our patients. There's a lot of appointments when you start this. There's a lot of people. There's a lot of, scans. So we want to be that central hub to really make patients feel like everything's coordinated, everything is feasible for them, and just that extra hand-holding to get them started on their treatment journey.
Dr. Chen, what sets proton therapy apart from conventional forms of radiation?
Radiation is a really important way to cure cancer. We use radiation to cure all sorts of cancer: breast cancer, brain tumors, lung cancer, prostate cancer. What proton therapy is a type of radiation that is able to cure cancer but reduce the side effects, which I think is really, really important. So conventional radiation that all the centers have, the beam that's used can go through the patient, hit the tumor, but it also goes all the way through and therefore hits more organs, and sometimes radiation hitting organs can cause side effects. Proton therapy, what the graph is showing is that you can actually, the beam will enter the patient, and it's actually a very sharp drop-off. Once the beam hits the tumor, it stops, and therefore it's able to cure just the same as any other type of radiation, but really no dose beyond the tumor, and therefore is able to reduce side effects. And that's a really huge difference between regular radiation that drops and proton radiation that drops and regular radiation that goes all the way through the patient and hits more organs.
And that's actually called the Bragg peak, right there. It hits and then it drops
the yellow
off.
Bragg peak that completes. Now, I would also say that, of course, just as not all the cars are the same, not all the proton machines are the same. Some of the proton machines have a more sharp drop-off of Bragg peak, and other machines it's a little bit less sharp and still hits more organs. And so there is a difference in proton therapy in different centers.
So the machine matters.
The machine is really important.
Dr. Rotondo, how do you personalize this therapy for each patient? Because not all machines, as we now know, are created equal, but neither are the patients. So can you describe the process? How do you map this out for each patient?
Right, so each patient is unique, each tumor or cancer is unique, and so they initially undergo what we call a CT simulation or a mapping scan, where again there's individualized immobilization devices for each patient to again immobilize and place them in a very reproducible position. We then use information from our clinical exam, from imaging, and we'll register that imaging, whether it be MRI, PET scan, or other imaging, with that mapping scan, and then that's where the radiation oncologist will delineate the targets and the areas at risk. That then moves on to the dosimetrist, and we work in collaboration with them, and they develop a very, again, individualized, unique treatment plan for each patient and each target. And so you can have the same target and send it to different dosimetrists, and they can come up with a very unique or different plan. So it's not always uniform, and that's why it's really important. We're very fortunate to have some of the best and experienced proton dosimetrists who've actually won national and international awards in competitions for treatment planning to develop a very unique and tailored treatment plan for that patient, where you maximally spare normal healthy tissue and focus most of the radiation within the target.
And these plans are often referred to as a pencil beam scanning. Explain what that is.
Yeah, so the older form or technique of proton therapy is something called double scatter or passive scattering, and that's where the proton beam is passively scattered with two scattering components to create a uniform distribution of radiation dose. And the way these tumors are treated are in layers. So we start with the deepest layer, and then as you modulate the energy and decrease the energy, you're painting each layer. And so it creates a uniform dose. With pencil beam scanning, it's an active scanning technique where a very focused, narrow beam of protons is actively scanned using and steered with magnets to paint each layer one by one. And so I like to think of it as painting with a roller versus painting with a fine Picasso brush. And so, if you imagine an irregularly shaped target, or you're painting something that's irregularly shaped, it's a lot harder to stay within the lines with a roller. Whereas if you have a very fine brush, you can be more precise and more focused and spare better the normal healthy tissues and critical organs.
Dr. Chen, big team you have behind you. Tell us a little bit more about all of the people involved in making this all come together for each individual patient.
Yeah, I think we talked about how important having the best proton machine is, but that's really just the machine, and we need the people behind the scenes to actually help design the radiation plan and take care of the cancer patient, really. And so I think part of the team, I think people realize, are the doctors. And so our proton team includes doctors that specialize in different cancers. I treat prostate and bladder cancers. Dr. Rotundo treats kids and brain tumors. And we have doctors who treat Robert, who just focus on head and neck cancer. So having specialized doctors that really just focus on particular cancers is really important. We talked about the dosimetrists. The dosimetrists are actually the staff members who create the radiation plan for each patient based on their anatomy and how to award organs. And all dosimetrists have won international awards creating the best plans, competing with cancer centers around the country. So the specialized physicians, the dosimetrists who actually create the plans, the physicists who really know how to use the machine and technology, the nurses, the other staff, the nurse navigators, that's the team that we have.
Sarah, you focus on children primarily.
Yes.
But what does it feel like? Does it feel like 500 so far?
It feels like 500.
It does feel like 500.
In a good way. Those are 500 of the bravest people you're ever going to meet. But like he was explaining, there's so many people that touch these patients in the plans, and there's so much coordination that behind the scenes happens to make things go smoothly for these patients, and it feels like 500, but it's a huge celebration.
But you're playing such a big role in these people's lives. What's that feel like to you on a personal level?
I mean, I feel insanely blessed that I get the opportunity for these families, these patients to trust me with their care and with their coordination of care on their good and bad days. You know, the therapists and nurses that see these patients every single day are some of the reasons they come back every day, even on their tough days. So just very, very blessed to be a part of that team.
Well, now it's a time to take a look back at some of our youngest proton patients. We followed a story before of a little girl named Kamaya. She had brain cancer. She's a triplet, and her mom noticed that Kamaya began missing some big developmental milestones. Her eyes began to cross. Doctors eventually diagnosed Kamaya with a rare, aggressive, fast-growing cancer that occurs in the brain and in the spinal cord. Kamaya came here for her treatment, and we now have an update that we are so happy to share with you. Kamaya is now 2 years old, and she has been in remission for a full year. Her mom shared some of these pictures with us. Dr. Rotundo, talk about why Kamaya was such a good candidate for proton therapy.
Yeah, so it's so nice to see that. And so pediatric patients or kids are particularly sensitive to the late effects of radiation. Even low doses or moderate doses can have significant impacts on growth and development. Kamaya had a brain tumor at a very young age that required very aggressive treatment, including surgery, chemotherapy, and radiation therapy. With proton therapy, she was a good candidate because using or leveraging the benefits of proton therapy, we were able to significantly reduce the dose to a normal healthy brain, reducing the risk of neurocognitive effects, issues with memory, concentration, IQ, significantly reduce risk of hearing loss, vision loss. We were able to spare her pituitary gland, so in terms of hormone production, which is not only important for growth, but also for progressing through puberty and and fertility. So we were really able to give an effective treatment that targets the tumor while minimizing radiation exposure to normal healthy tissues and minimizing both her acute effects and late effects of treatment, and trying to ensure that she has the best quality of life possible despite the very aggressive treatment she needed.
Sarah, what's it like to see and hear this update?
It's emotional, like in a very good way, because I think when you tell people what you do, a lot of times people are like, oh my gosh, that must be so sad. But you see these success stories, and this is what keeps you going and fighting hard and getting better at what you do, for sure. Exciting.
Yeah, it is exciting. Dr. Chen, what cancers are potentially good for proton therapy, currently now and then possibly in the future?
Well, I think if we think about how proton is a type of radiation, and it works the same as other types of radiation to cure all different kinds of cancer, but is able to reduce side effects, then proton therapy could potentially be used for every kind of cancer that needs radiation. We often think about how proton therapy is good for children, like Kamaya, because children have growing organs, and the least amount of radiation we can give to those organs as they're growing is really important. But proton therapy is also really good for many types of adult cancers, like Robert's head neck cancer. In the head neck region, we want to treat the tumor, but there's all these other structures, blood vessels, the vocal cord, swallowing tube, and proton therapy can help us treat the cancer and avoid those organs as much as possible to reduce side effects. That's important. Brain tumors, we use proton therapy for breast cancer, sometimes for prostate cancer. So for any kind of cancer where radiation's used to try to cure the patient, proton therapy could be a replacement to reduce side effects further.
Sarah, what do you notice as the biggest differences as an adult goes through the process versus maybe a child going through the process? What do you notice, just maybe not medically, but just emotionally as they're going through?
Surprisingly, I don't see as many differences as you'd think, because no matter what, each patient, we're treating them as a whole entity, and that entity includes family members. Mm-hmm. I think with kids, you're really working with the kid and the parents very intimately in all those decisions, and so the biggest difference I would notice, I would say, is that you put. I was gonna say you put more time, but we put time into everybody. You really want parents to feel confident in the decisions they're making and what they're doing daily to help their kid have the best outcome and prognosis. And so it's that extra time and just really making sure you're supporting everybody in that situation, not just the patient.
I want to show this map of proton centers from the National Association for Proton Therapy. It goes to show really there's just kind of this desert between here and Arizona. Dr. Rotondo, it's great having this resource close to home, but as we've mentioned, some patients just traveling from several states away to get care here, right?
Absolutely. So we've treated patients from across Kansas and Missouri, but we've also had patients from Colorado, from Nebraska, from Arkansas, and as far away as from California. So patients are certainly traveling to get this care.
Dr. Chen, just comment on that. Just important that we fill that gap for patients that need this specific type of care.
I think it's so important. I think many patients want to seek the best cancer treatment they can, and oftentimes that's here at University of Kansas Health System, our cancer center, and that's oftentimes proton therapy. Many of our doctors in my department are licensed in multiple surrounding states, so then patients can actually get their initial consultation by telehealth, just a phone call with us. Am I a good candidate? Is proton therapy available? So that makes it really easy for them to access our recommendations. And if it is a good option for them, we have many patients who travel here for treatment, and as Dr. Rotondo says, several weeks long, everyday treatment. But we have Hope Lodge as a resource for patients and families to stay in. So really try to make it as easy as possible for patients to get the best cancer care that they can.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Okay, Dr. Rotondo, we had mentioned that you are the first doctor in the world to get 2 years of fellowship training in pediatric proton therapy. Explain exactly what that means.
So that always feels uncomfortable.
I know, and that's why we have to make you a little uncomfortable on this Monday.
So I actually did 3 years of fellowship training, one in adult and pediatric.
Excuse me, 3 years.
but 2 in dedicated pediatric proton therapy. And so essentially it's 2 to 3 years post-residency training dedicated specifically in proton therapy and pediatric proton therapy. And so through that experience, working alongside some of the world experts in the field, and again training at one of the highest volume pediatric proton centers in the world in Jacksonville, Florida. It really gave me a unique and a great foundation in terms of experience and expertise in the things that I treat and in proton therapy in general, and upon which I've kind of built over the years in clinical practice. And so it comes back to the team, and it's not necessarily unique to me. We have an incredible faculty who've trained and worked at centers across the country. We have people from Harvard, from MD Anderson, from Mayo, from Emory, physicians and physicists. And so it's really what you get when you come to KU, which is a really experienced team with a significant level of expertise in proton therapy and disease.
Like you, like this guy, kind of, yes. kind of 2 guys that are kind of a big deal around here. Just lots of expertise working together for these patients and navigators like Sarah. So we appreciate this. We want to get to some questions from our viewers this morning. And Angie has one. A question we have to ask. What are the side effects of proton therapy?
So the side effects, it's highly dependent, just like in any type of radiation, it depends on the anatomic location. So the side effects profile varies significantly depending on where we're treating. So for instance, if you're treating in an intracranial tumor or brain tumor, you can have things like fatigue or nausea or decreased appetite. If you're treating the head and neck, as we were referring to the case before, you can have irritation of the mucosa, the lining in your mouth or your throat, can cause pain or discomfort or issues with swallowing. If you're treating prostate cancer, like Dr. Chen does, you might have some irritation of the bladder or bowels. And so it varies significantly. The key point, I think, with proton therapy is that we can really leverage the dosimetric advantage of proton therapy in minimizing the exposure of surrounding normal healthy tissues and organs to radiation. And so we can decrease, in many instances, the acute effects and also late effects of treatment. So, for instance, in head and neck cancers data, decreased instance of requiring a feeding tube or dependency on a feeding tube or requiring pain medication to manage pain with swallowing from radiation. So the key thing is that proton therapy can significantly reduce side effects from treatment.
Jeremy has a question. Are there any hurdles to insurance with proton therapy, like considering it experimental or anything like that?
I'll answer that. So I think that's a very common question, is whether proton therapy will be covered by insurance. Mm-hmm. I think one of the things I think is really great about our department is that we actually have a lot of experience working with insurance companies with proton therapy, with actually any kind of cancer treatment. And if we believe that proton therapy is indicated for a particular patient's diagnosis, we will usually, if we get it denied, we'll appeal aggressively, and oftentimes we're able to get that covered. So if it's indicated and we believe that that's the best for the patient, we will work with the insurance company to try to get it covered.
Amy wants to know, where do you see the Proton Center in 5 years? Dr. Rotondo, I'll start with you.
So I think we're very excited to celebrate our 500th patient, but we certainly will be celebrating a much higher number by then, and hopefully extending our reach to patients and increasing our access to patients to this treatment, expanding our indications, and also keeping up with advances in the field. So we have the state-of-the-art treatment equipment at the moment, but we're actively keeping up with advances and also playing a leading role in that development. So we, our physics team is playing a leading role in developing or bringing flash therapy, proton therapy to clinical fruition and many other exciting projects to advance the field of proton therapy.
What's flash therapy?
So flash therapy is where you can deliver a very high dose of radiation in a very short period of time. And some of the biological studies suggest that you can preserve the effect on the tumor while minimizing or reducing the effects on, further reducing the effects on surrounding normal tissue. And so it has the potential to significantly shorten the duration of treatment and potentially maintain or exceed control rates with fewer side effects. So it's a very exciting field, and KU is playing a leading role in developing that.
Dr. Chen, where would you like to see the Proton Center in 5 years?
Well, I think some of the major changes are happening. I think one is that treatment is getting shorter, which I think is really good for patients to allow it to be more accessible and less impact on patients' lives. So if we think about how, for example, prostate cancer radiation, the old way of treating that would be 8 to 9 weeks of everyday treatment, 40, 45 sessions, which is really horrible to take 2 months away of everyday's life for patients and families. We have moved now to, we really give 5 weeks. So going from 9 weeks down to 5 weeks is what we're doing for prostate proton therapy today. And it continues to get shorter. And that getting shorter is happening with multiple cancers. So I see that happening more and more in the next 5 years. And flash therapy, where we may be able to give treatment in one session and further reduce side effects, is really exciting, and we're leading the world in the research in developing flash proton therapy.
Sarah, what do you want the big takeaway to be for those listening and watching today?
I think the big takeaway for me is it's just gratefulness and a big thank you to, like I said, the patients that trust us with their care every single day through this journey, and to the staff behind the scenes. They're not always seen, it's not always known what everybody's doing to make this all work, but a lot of things go into this, and I'm grateful to have such a great team that makes it happen.
Dr. Rotondo?
Well, I guess as Kansas City's first proton therapy center, just incredibly excited to be reaching this milestone, and really proud of the team that we've put together and made this possible. I think, as the region's only NCI comprehensive designated cancer center, we continue to be committed to offering the most advanced and state-of-the-art cancer treatments and opportunities for clinical trials. And so that includes proton therapy. Want to thank certainly the patients, but also the Cancer Center, the health system, and the community for supporting us. And just to our listeners, and if you've recently been diagnosed, or someone that's been diagnosed, to just consider reaching out, getting an opinion, seeing if proton therapy is the best choice for you. And Sarah will do a great job walking you through that.
Congrats on the big milestone. Dr. Chen, 500 plus patients treated so far with proton therapy. What's the big takeaway today?
I'm so proud to see where our proton therapy program is and the number of patients and families that we've been able to touch in the last 2 to 3 years. But I think the big takeaway is proton therapy is not all the same. It's not proton therapy. It's the best proton therapy machine that's the most accurate for each patient. It's the doctors who specialize in the particular type of cancer. It's the dosimetrist who is really good at creating the best plan possible to avoid the organs and reduce side effects. It's the nurse navigator that takes the patient all the way through the journey. It's our therapists on the machines, our nurses. That's what makes our proton therapy program so unique and so awesome, and looking forward to the next 500 patients.
Thank you all for the part you each play in our patient care. Thank you for being here and sharing your expertise. Thanks to our guests for being here with us, and we'll see you back here tomorrow. Coming up tomorrow on the Morning Medical Update, from men to women and from older to younger, the cancer statistics are slowly shifting. I'm Jessica Lovell on the next Morning Medical Update. Meet one young woman diagnosed in her early 30s, how her story is already helping other women catch cancer early. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.